Hello, I am Dr. Steve Johnson, and I want to welcome you today to this program, which is the session 3 or episode 3 in REBT Master Class Series. And today we are going to be taking what we've learned in the first 2 episodes and putting them together and applying them to look at anxiety and depression, very common kinds of conditions or emotions that individuals bring into therapy. Excuse me. And we will walk through the process, looking at some interventions, but also the conceptualization of anxiety and depression. In upcoming episodes, we'll go more into depth on the types of interventions that we often use within REBT. So let's begin. And the presentation. And let's begin with a fictitious case, Sarah. Sarah's a 28-year-old marketing exec who experiences very intense anxiety before important work presentations, especially in front of others, right? She has trouble sleeping, rehearses excessively, avoids eye contact during presentations, and then experiences physical symptoms such as racing heart and nausea. Now, from an REBT perspective, if we first begin looking at the ABC, and remember, in the ABC, we want to get the activating event, particularly the critical activating event. We also want to identify the inference that the individual is making. In this particular case, the client, Sarah, is making an inference. What we know in REBT, that the general inference for anxiety, regardless of the case, the general inference is that the individual is perceiving an environmental threat. And then we look at what the specific environmental threat is. And so in this case, we would say that the activating, and we get this in conversation with the client, of course, that Sarah is asked to give a presentation in front of senior management. So that's the very particular activating event or situation in which we see the anxiety arise. The inference, of course, is that there is an environmental threat. Particularly in this case, the inference is that if I make a mistake, they will think that I'm incompetent and might fire me. So we can see very clearly the inferred threat in the environment. Now, in the conceptualization of emotion, we take further steps after we get that inference of threat. We look at associated unhelpful, sometimes called irrational beliefs. I prefer to call them unhelpful beliefs about that upon that particular inference about that situation. It's based on the inference, right? Without the inference, we wouldn't see these. So the inference sets the stage for these dysfunctional beliefs that then will give rise to the anxiety itself. So remember the typical beliefs that we look at in REBT are demandingness, awfulizing, or catastrophizing, frustration, intolerance. Lynn Clark, University of Kentucky, calls it I can't stand it-itis, and then global negative rating of self, others, life, and world. So in this particular case, the demandingness takes the form of I must perform perfectly or else I will embarrass myself, right? And then we might also say, and I must not do that. Awfulizing is that if I make a mistake, and again, we get these by discussing the clients. We don't make them up ourselves. We get them from the words of the client. Awfulizing, if I make a mistake, it will be absolutely horrible, and I won't be able to recover from that. It's just too much, right? It's as bad as things get. In addition, the individual may have, in this particular case, frustration and intolerance. I cannot stand feeling this anxious before the presentation. This is overwhelming. This is intolerable. And then that idea of overwhelmingness, that's not an emotion. Overwhelmingness is not an emotion. It is a cognition. And when we feel, when we experience that cognition, then we often experience anxiety. Okay. So I cannot stand this feeling this anxious before the presentation. And the global negative rating is the global negative rating of the self. So we would call that ego anxiety more than discomfort anxiety, but ego anxiety, where we globally negative rate the self. If I mess up, it means that I'm a failure as a professional. So it's an attack upon the self. It's not about feeling uncomfortable, although that may be present too, but it goes deeper than that and is a global negative evaluation of the self as a failure if they don't do well in the presentation or live up to the standard that they are imposing upon themselves. Then we look at the C. So far we've gotten the A. We know what the inference is, that what the particular threat the client is inferring on or attributing to the environment. And then we look at, we got beliefs, and then we're looking at the emotional behavioral consequences. So, of course, the emotion may be intense anxiety, fear, dread. Those are all pretty much synonyms. Behavior, we might see with this particular client that she's avoiding eye contact. In fact, that's what is reported. She may speak too quickly, may spend a lot of time over preparing, and maybe not able to do, which may interfere with other goals, maybe interpersonal goals, because she's just really over preparing. And she avoids presentations when possible, because avoidance is the typical kind of behavioral response we see with anxiety. So what we've done here is the A, B, C, and with the B, we looked at inferences and beliefs. Okay, so let's go a little bit further in this particular fictional case and look at disputation. We've already learned that one of the things that REBT does, it's an intervention, is to dispute or challenge the dysfunctional belief, the belief that's not helpful and that gives rise to the the anxiety. And so we discussed several different types of disputes. One that's very commonly used, and many clients respond to this one quite effectively, is the pragmatic, or also called the functional dispute. There's also the empirical dispute, where we use data within an argument form to pose to the client. We use friendship dispute, and then we'll get into a couple of others, particularly with this client and others. So in this particular case, not the, but a possible pragmatic or functional dispute would be, how is it helping you? And she could be saying this to herself when she learns how to dispute her own beliefs. How is this helping me to believe that I must absolutely be perfect? And most people will come to realize it doesn't help them. What it gets them is anxiety. Does that belief make me more effective in my presentation if I put that demand on myself, especially that heavy demand? Okay, so why are we doing this? We're wanting to help the client realize that the belief that they're holding is dysfunctional, to set the stage to maybe collaborate with the client to replace that dysfunctional belief with one that is more adaptive and helpful. An empirical dispute might take the form of, has anyone ever given a perfect presentation? Does such a thing even exist? Am I even being, am I within empirical data to make that kind of demand upon myself? Do people really get fired for minor mistakes? Well, possibly, it's possible, but it's not as probable. That's the trouble, though, with anxiety, is sometimes they will exaggerate the possible to the probable, or they believe it's 100% the case within their situation. And then there is a friendship dispute. Friendship disputes can be quite good, particularly on individuals who are quite kind to their friends, but really harsh upon the self. And a friendship dispute in this particular case might be, it would be if my friend told me that they had to be perfect or else they would be worthless, would I agree with them? What would I say to them? What I would say, yeah, if you mess up, that means you're an utter failure as a human being. We say, no, we wouldn't say that to a friend. Why not? Well, because it's not helpful. It's not even true. Okay, so why are we doing that? Why are you doing that to yourself? Why am I doing that to myself? Right? It's not helpful. It's not kind. It's not affirming myself in any way. It's not moving me toward the goals that I want to achieve. Then if there are, let's look at three other possible kinds of disputes. One is the logical dispute. Many people don't respond to that one as much as they would the pragmatic or functional, but you never know a priori until you start working with a client how they might respond. So we typically will try different kinds of disputes to see which ones work with the client or have them practice those, um, you know, later on when they encounter the critical activating event. The logical dispute might be, does my entire worth as a professional really depend on one presentation? This presentation, right? So what we're showing that it's not logical to take this and then aggrandize it or generalize it or exaggerate it, which is the dynamic of most unhelpful beliefs. Metaphorical disputes can be quite powerful for clients, especially if we get some knowledge about that individual's culture, their interests, things that that are passionate about. And so sometimes we can pull in a potential metaphorical dispute from our what we've learned about our client and their culture, etc. So in this case, one might be, isn't this like expecting to never trip while learning to walk? You know, learning to walk, we certainly don't, you know, uh, make fault of people because they trip. Or even if they've walked for a long time and they trip, we go, sorry, how can I help you? Or if I trip once, we go, oh, wow, I better take a look at where I'm going. That kind of thing, rather than making this huge evaluation upon the self and aggrandizing that. Okay. The next one we need to use with caution because it's not always easy, and we may not know a priori how people will respond to humor. So, and I've given presentations all over the world, and sometimes I think I'm using a humorous dispute, and then I realize that fell flat. It didn't. The sense of humor in that culture is different than my sense of humor, or maybe my sense of humor was, just not real helpful for anybody in that moment. But if we get to know them and we see how they respond to things, then we cautiously can move into a humorous dispute. But we always let individuals know before we do any disputation whatsoever that we may be challenging the beliefs. We are not evaluating the self. We're certainly not trying to say that the individual is utterly illogical or, that they just are a bundle of dysfunctional beliefs. We certainly don't want to do that. So in this case, we may have a dispute like, so if I say, once, should I move to the mountains and never show my face again? If I trip over some words or if I'm forgetful, should I become a hermit and should I socially isolate? And if you want to be a hermit, be a hermit. But this would be an exaggerated response if that's not your goal in life. So with caution, we would use this. So notice we've kind of come up with 6 potential kinds of disputes. And we don't know a priori which one will work. So we try these out. And then as we work with a client over time, we can see to which they respond better than the others. And we have them check that out as they're disputing their beliefs themselves. What's the goal is to replace that dysfunctional belief as much as possible or decrease the incidence that it pops up with some effective new thinking and action associated with that. In the ABCD model, this would be the E. The A, B, the C we've already covered. D would be the disputing, and E would be the effective new beliefs or effective new thinking and the associated behavioral action. Okay, so what we would want here? What's the goal? The replacement goals. One would be to accept that anxiety is a normal response. It certainly does not make someone abnormal. Here you can see this is how REBT goes about validating the client. Some clinicians say, well, how are you validating? Do you validate that their belief is normal, that that's how they should feel? Well, we will say that it's normal. We won't go to that's how it should be, because then I'm making a demand about what that client should experience, and I have no right to do that. So what we will do is, help them accept that anxiety is just a normal response. It's not overwhelming. It's a challenge, and it's a manageable challenge that we can overcome collaboratively working together. The other one would be learning to self-regulate the emotions. Another one would be approaching presentations, right? So we want to get back into almost exposure here, approaching presentations, but with the mindset that what if I make a mistake? What if I stumble? What if I, and don't use the appropriate word or whatever. Just say, okay, let this be a learning experience. See what I learn about it and then move on, instead of having a performance-based self-worth perspective that your self-worth is contingent on your performance rather than embrace unconditional self-acceptance. Okay, so here are some interventions that are in REBT. This is just a small number, and we will in subsequent episodes go into many, many more different types of interventions. I just wanted to give you an example of some that we would use with anxiety or depression. Okay, so the interventions that we use fall into three categories: cognitive interventions, behavioral interventions, and then emotive interventions, those that are tied to emotion. All of these are interconnected. Beliefs, emotions, and behaviors are interconnected. So when we have an intervention that we call cognitive, the result is that we're probably going to be changing some behavior and emotions. That's the good thing about the interconnectedness of those aspects of our humanity. And it makes it easier for us to help clients because we can begin with whatever might seem to be a better inroad into making some helpful changes for our clients. So with anxiety, we may have a cognitive intervention, and we demonstrated this, right? Identify and challenge the perfectionistic thinking through the disputation that we showed. Perfectionism we often see with anxiety because perfectionism is often grounded in a demand. It's okay if somebody wants to do as well as they want. It's okay for them to want to be perfectionistic. It's when they elevate the want or the desire or the wish or the want or the hope up to a demand that we set the stage for potential emotional disturbance, right? Not necessarily clinical diagnosis, but not helpful in life. A behavioral one might be gradual exposure to public speaking situations, multiply the number of public speaking situations so they get practice on this, and with self-rating of performance rather than looking at external validation from others on this. Just kind of have a goal in your performance and see if you reach that goal, right? But it's not evaluate the self. It is an internal goal based upon your role as giving a presentation. Okay, don't make it about your self-worth. Emotive we might use something that I talked about last week, and that is the use of rational emotive imagery to practice feeling maybe concern, which would be a functional emotion that within REBT we would say the functional alternative to anxiety is concern. Now remember, the way that we determine whether an emotion is functional or not functional is whether that emotion is helping an individual attain their desired life goals, whether they're short-term or long-term goals, right? And so if what they're calling anxiety is not helping them, then then we would want to work with them. So we have an ideal vocabulary. Clients don't have to use it, but sometimes using a different word can help the client. And so in the ideal vocabulary of REBT, we would say that the functional alternative to the anxiety, which is inhibiting or stopping the attainment of the desired life goals, would be concern, which is a negative emotion in that it doesn't feel good, but you can feel concern and actually do a pretty good job in attaining your goals. You may not be in your A game, but you can still do it. Anxiety will be the word we use for that emotion. It doesn't. Again, clients don't have to use these words. They don't. They'll use whatever word, and it's incumbent on the therapist to ask questions to see that whatever label they give to the emotion that they're experiencing is either helpful to them or not helpful to them. So what do we do? How do we do rational emotive imagery? Let's say the individuals, such as we have now, who is experiencing anxiety, and we've seen the ways that it's dysfunctional for that client. We would sit with them and we would do the imagery, and so the therapist would ask them to visualize giving the presentation, right, as vividly as possible, and then try to make themselves even become anxious in that visualization. And then we say, as soon as you are able, we say this to the client, as soon as you are able to make yourself anxious, then let's stop. Okay? And we calm down a little bit, we talk, we chat, etc. And then we say, let's do the same imagery. Want you to visualize giving the presentation just as you did before. But this time, I want you to work on making yourself feel concerned, but not anxious. Okay? Now, we've talked about that in session, the difference between those two states. And so the client would, have an awareness of that. And so we say, and when you feel concern rather than anxiety, let me know, and then we'll stop. So as soon as that happens, we stop. And then the therapist and the client have a discussion about what internal change did the client make in their thinking that resulted in the experiencing concern rather than anxiety. And so what do? We practice that. We have them practice that. We may say, let's let's find a time every day, a good time for you when you can just go through this imagery, right? And practice doing that. And we often say, give yourself a reward when you do that. So let's say they say, 7:30 at night, I've come home, I did some unwinding, I've talked to the family, we had something to eat, and before I sit down and maybe watch TV or do some preparation for next day's work, then I take about 10, 15 minutes to do the rational emotive imagery, and so they practice this. And so this is about effective mood management, and so it's really quite a helpful one, and can be fun in the counseling room if we do it and take that approach to it. Also, we want to make sure that we identify any unhelpful goal that the client has, because sometimes the goals that they have, say with anxiety, the client may develop some unrealistic goals, unhelpful goals. And so we want to collaborate with the client so we can help shift those so that they're working toward a goal that will really be beneficial to them and that they see the benefit of it. One very common that our friends in acceptance and commitment therapy talk about is what they call the dead man's goal, which is an utterly unhelpful goal. And that would be when they just want to stop an emotion. I want to stop. And so in this case, she could have had a goal. I want to stop feeling anxious before presentations. To stop feeling emotion is not a great strategy. The best way to do it, and that's why they call it dead man's goal, is not to be alive. What we rather be is an alive human who has the capacity to experience the full range of emotions, but work on not trying to shut off emotions. When we shut off emotions, we shut off emotions to so many other things that make life richer, even if they're negative emotions. Sometimes, helpful negative emotions can be motivating for us. Unhelpful ones tend to have the opposite effect. Okay, dead man goal. We would try to negotiate. Let's see if we can work on a feeling that may not be positive, but it's not going to be as disruptive as the anxiety. So we can negotiate that. Another kind of unhelpful goal, typically, although there are certain situations when we may do it, is what we would call an avoidance goal. So if she said, I will avoid situations where I might embarrass myself. Well, the why avoidance goals are unhelpful is one, they get very complicated because you have to figure out all the ways you can avoid it, right? And especially if it's part of your work, thinking of all the ways to avoid it may be quite complicated, or not help you. You get fired by not doing the presentations, particularly if it's a part of your job. And then, and life gets smaller. The more we avoid, the smaller our life gets. Whereas if we take it on, we face it, not avoid it. May not feel comfortable, but we expand our world and we learn to have those emotions and to change the ones that may be more dysfunctional and embrace the ones and move toward the ones that are more functional. So an approach goal might be, I will practice self-acceptance and focus on my effort rather than perfection. I'm going to go, oh, yeah, I really did what I could here. And then look at what went well, what didn't go so well, and then brainstorm about how you can make some changes or even talk to others about it. See, so, I was really working on this point. I felt I wasn't really good on that point. What did you see in that kind of thing? Develop some curiosity about it rather than embrace condemnation toward the self about it, which will not help in any way whatsoever. Okay, so these are ways that we can, some interventions with that. The other one is when you develop goals with the clients, make sure that they're smart. So we want them specific, measurable, achievable, relevant, and time-bound, right? And then, of course, we're adding, let's not do those dead man goals, and let's use more approach goals than avoidance goals. Those are additions to these SMART goals that will beef up the SMART goals. We know from research that if you engage in SMART goals and you tell your friends about it, if you have a SMART goal, right, then that's about 43% effective in your attainment of the goal. If you share that with a friend, you share that goal, and therapists, and you're sharing it with them, it goes from 40-some% up to 70-some%. And then it can go even higher if we make sure it's an approach goal more than an avoidance goal. So in this case, specific, Sarah will practice self-acceptance and reduce perfectionistic thinking when preparing for the presentation. That's very specific, okay? Measurable. She's going to rate the level of self-acceptance before and after each presentation on a scale of 1 to 10. We can measure that. It's achievable. She will challenge one irrational or unhelpful belief before each presentation. Now, she said, I'm going to have to do all of them. That may be a bit overwhelming. So let's just break it down and try to challenge one of those beliefs before the presentation. It has to be relevant. Shifting to concern will improve her professional performance and confidence. So having that as a goal is quite relevant and time-bound. So she might have, and again, there's great flexibility here. These are not the only ones that an individual has. These are just some examples. Time-bound, she'll complete 3 presentations in the next 2 months using this type of goals, right? So we don't want to push it way out to the future, don't want to avoid it, but bring it on. as much as possible. So I hope that part is helpful. Let's shift over to depression. Okay. Um, I've got to be very cognizant of time because I have another presentation that I'm giving immediately after this. But in the same case, we have James, a 45-year-old recently divorced man who has withdrawn from friends and his hobbies. He frequently, sits around and ruminates about his marriage, about how his marriage ended, and he believes he will never be happy again. Okay? So that's the case. We're going to do the same thing. What's the activating event? Well, James' wife filed for divorce after 15 years of marriage. Boom. We don't need many more details than that. Inference. The inference for depression, and we will get more into this in upcoming episodes. The inference for depression, we make an attribution that we have experienced or will experience and a loss that is really important to us. So we know what the loss is for him. Because my marriage ended, I will live the rest of my life all alone. So he's lost companionship. So that would be the inference that sets the stage for his depression. And then what are the associated dysfunctional beliefs with that inference? So we have the inference, we've set the stage for depression, but the inference is not enough. You may say, I'll be all alone, but you may say, okay, fine, I'll deal with it. And so he may not develop depression about it. Or he may say, oh, that's awful, that's terrible, that's horrible, and get anxious about it, but not depressed. So it's not the inference that directly causes the emotions. The emotions are more closely caused by the dysfunctional beliefs. However, the inference set the stage for those. So the demandingness here might be my marriage should not have ended. It must have lasted forever. Not a helpful, that's nice as a goal or a desire, but to make it a demand in the face of, another person having free will and doing what they want may not be the best and most functional belief. Awfulizing. Divorce is the worst thing that could have happened to me. I don't know. All kinds of things could happen. You could be divorced and one of your children die. You could be divorced and you get terminal cancer. You see, so things could be worse, right? Now, challenging that, we need to be very cautious about that, right? We don't want to look as though we are insensitive and are unempathic about their loss. The loss matters, right? We don't want to say that loss is good at any level for them, especially in the initial parts of that. Frustration and intolerance. I cannot handle being alone and feeling this way. Right? Well, they are already handling it. But when you believe that you can't handle it or it's too much, it's overwhelming, then that does impede on your life in many ways, emotionally, behaviorally, levels of satisfaction, and all kinds of things. Or the global negative rating. Because my marriage failed, I'm a worthless person who will never be happy again. Again, that's a global negative rating of self. Global negative rating of self is commonly present in depression. If he were angry, then he may not have global negative rating of self. He may have global negative rating of his wife, okay, which would be more typical of anger than depression. Now, he may alternate between the two of those. So he may at times feel he feels depressed, and at other times he switches over to anger, right? So that would be common. These emotions are equal all paternity employers, unfortunately, and contingent on how we're looking at and viewing the event that we're going through. Okay. So the emotion here would be depression. And in REBT, especially if you're dealing with inference or something, you'll look at the DSM-5 and the diagnostic criteria to make a label for that. But the emotion from an REBT perspective, given the loss and the emotion, the cognitions and the behaviors associated with that, would be depression. So, and then the behavior that is associated with that. So remember, we always look at the inference, we always look at the beliefs, but you also need to look at the behavior. Well, the typical behavior for depression is withdrawal, and often it's social withdrawal, but it's also withdrawal from uh, activities that we do, hobbies or whatever, exercise that help, you know, us experience pleasure or that we enjoy, and or we feel is contributing to health or any number of things. So the behavior could be social withdrawal, loss of interest in activities, pull away from things, or excessive rumination, where we just go over it and over it and over it and over it and over the loss. And if we do it to the point where we can't break it, we call that perseveration. But just going over it and over doesn't help. You're not getting any more data out of it. All you're getting is more depressed. Okay, so it's dysfunctional. So what about disputation? Well, again, we're going to go through the same types, and we'll just give examples here. Pragmatic and functional dispute always is about how is this helping you? How does it help me to believe that I'm worthless? Does that belief lead me to a better life? Does it improve the divorce process in any way for me to believe that I'm utterly worthless? No, not at all. Empirical dispute. Do all divorced people remain unhappy forever? There's no research that shows that. Many people have gotten divorced, even if it's initially not a great thing. Many people adapt to it and move on in life and get married again, or choose to live a single life, have friends, and all kinds of things. So, do all divorced people remain unhappy forever? Or we would say, is there any evidence that all divorced people are utterly unhappy for the rest of their life? Is there any evidence that you will be happy, that you will never be happy again? There is none. There cannot be. Friendship dispute. Would I tell my best friend that their divorce means that they're utterly worthless? I can't imagine doing that. I can't imagine if I'm saying that to my friend, I'm not a great friend, right? Because it's not supportive. It is not helpful to that individual who is going through a rough time already, right? It's not uplifting. So why do that to yourself? Treat yourself as though you are your best friend and be uplifting and affirming for yourself. Okay. Logical dispute. Does one failed relationship logically mean that I'm a failure, utter failure as a person? Doesn't logically follow. A one failed relationship, the most you can get out of that is I failed at that relationship in some way, or I contributed to the failure of a relationship, but that doesn't make me a failure as a human. I always tell my clients, you know what I call someone who contributed to a divorce and is experiencing a divorce? I call that a human, right? We all make mistakes. And, and sometimes it just doesn't work out in the way that we want. Metaphorical. Isn't this like saying that falling off a bike once means you should never ride again? Now, we have to be careful with that, but they go say, you know what? That's really minimizing what I'm going through right now. We go, I'm going to give a metaphor. I don't mean this in any way. So it's more the principle than the details. And I realize how important this marriage is to you. And I think it's wonderful that you have that wish or that want or that hope and those desires. Those are wonderful human traits. I'm happy that you have those. But, even if we have a child and they fall off the bike, it doesn't mean that they should never ride again. It means move on, and work on relationships some more. Humorous dispute. So because my marriage ended, should I just live in a cave and avoid all human contact? Be careful. Be careful with humorous disputes, because sometimes they'll take that as an attack upon the self. We never, ever should do something that feels like that. So we should always set the stage when we're using those kinds of things. Okay. So remember, the goal of that is to help them be motivated to make some change. And so that would be the E, the effective new thinking, effective new belief, and behavioral action. So maybe one of the things would be reframing the divorce as a life transition rather than a permanent personal defect, right? Um, many we go through all kinds of transitions, and divorce is one transition not everybody goes through, right? Um, Loss of a job is a transition. A lot of people go through that, right? But we can do what we can to move on, and changing the way we think about those losses can really help us engage in meaningful activities. Why is this important? This is exposure, right? Because with depression, we withdraw from pleasurable activities. So have them move toward meaningful activities. Now, they may not realize what those are. So in REBT, we have prepared sheets that people can try out to move toward meaningful activities. That's really helpful. Joel Voss, in his book, The Meaning of Life, has all kinds of these activities in different categories that individuals can embrace to enrich their lives, particularly in the face of losses, etc. The really fundamental one that is helpful is embracing unconditional self-acceptance. Accept yourself, in the face of the divorce, even if you did things that were not helpful to the health of the relationship. Accept yourself as a fallible human being who made mistakes, even if some of those mistakes were deliberate. Decent human beings sometimes do things deliberately, but not with the intent of destroying a relationship. So unconditionally accept yourself as fallible and worthwhile in the face of those mistakes. Interventions, cognitive. So disputation of global self-downing. Does a failed marriage truly mean I am worthless in all areas of life? So we would work on challenging the cognition and replacing it. Behavioral activation, gradual reintegration into social activities, hobbies, and self-care. In other words, reconnect with people, not isolate, not withdraw, reconnect with things that bring you pleasure, reconnect with yourself, and learn to take care of yourself in the midst of these important losses. And then an emotive one would be self-compassion exercises, and then the rational emotive imagery that we've already looked. So it would be a variation on that. Like, again, visualization of the disconnection that occurs within a divorce. See that, experience the depression, stop, and then go back into that visualization again. And this time, feel, feel sad. I mean, sadness is an emotion when something really, really important to us has been lost. We're not going to be happy. And to think that we should be happy is just not realistic at this, and so we need to um, stop that kind of thing as best we can. Um, but here's culturally, we have a problem. Um, Even individuals can get intolerant about having a helpful negative emotion. They hold dysfunctional beliefs about a helpful negative emotion. Sadness is a helpful negative emotion. Depression isn't, right? Depression can get in the way. Sadness doesn't have to get in the way. But if someone goes, I absolutely must not be sad about this, it's not realistic and it's not helpful. Or um, this is truly awful to be sad. No, it's not. It is to be a human. We don't like it. We don't want it. We don't desire it, but it's there. And realize the sadness, and we will work through the sadness to move beyond it. But don't rush it and don't avoid it, right? Because that'll make it worse in the long run. Um, uh, Frustration. I can't stand being sad. If we can't stand experiencing any negative emotion, even if it's a helpful negative emotion, we are creating a very, very small life for ourselves. Now, that makes sense in the short run, but we wouldn't want the client to remain there over the long haul. So part of it will be to help them realize that believing that they can't stand it doesn't help them. They're standing it. But when they believe they can't stand it, then that really increases the negative emotions, unhelpful negative emotion that may arise about their sadness. We call that a secondary disturbance. Someone could be sad and then they get depressed about being sad. Someone could be sad and they get anxious about being sad because they think it'll never go. Or someone could be sad and they get angry about being sad. So they're developing secondary symptoms, which is making the situation worse. So we're going to be talking about what to do with secondary symptoms in an upcoming episode. And then emotive, self-compassion exercises, rational motive imagery, and to help the individual, get to a state of self-acceptance. Again, the goals, we certainly don't want them to embrace a dead man's goal. I will stop feeling sad about my divorce. Not helpful. Feel the sadness, ride the sadness, but connect in other ways and all of the things that we've talked about. Avoidance goal, I will avoid thinking about my divorce to avoid feeling upset. That saying that will actually increase the likelihood that you dwell on that more, right? So if at times you just think about it, like in the rational mode, think about it, but learn how to take care of yourself and not go into the depression as much, but experience the sadness and then to work through the sadness. Develop an approach goal. I'm going to engage in meaningful activities and I'm going to interact with people. I'm going to build my sense of fulfillment that maybe I neglected for a while because I put it all on my one relationship. And so help them to realize that sometimes having an interlocking web of relationships with other people is a huge protective factor for all of us, right? And so these are approach goals can be quite helpful. And then the SMART goals. So James would re-engage with his social life and hobbies to counteract that social withdrawal, measurable. He might say, I'm going to do at least one social or recreational activity a week. His start with small, manageable social distractions like coffee with a friend. Maybe rather than flying off to Acapulco for a weekend with an individual, maybe, building up to something like that. Relevant, increasing social engagement may help the mood, may help the sense of self-worth and all kinds of things. And then if he, makes it a goal to achieve that goal within a particular time frame. So there's not avoidance and just pushing or procrastination. It's just pushing that goal attainment off. Okay. Any questions? Let me look at comments. Yes. And one individual is how much of the cultural setting is relevant? Yeah. Context is always important. We as therapists make mistakes when we divorce looking at symptoms from the context. The context matters. And so often when they give the activating event, I might say, where were you? Who was around? What was your relationship with those individuals? Those kinds of things we instantiated, to use a term from philosophy, to look at how that is. Okay. Interesting. Would practicing in front of a mirror with these SMART goals be just as effective or not because there's not an audience? You will get some benefit from practicing in front of a mirror. At least you are, interacting with one person, yourself, and it is important to have that relationship with the self. But we are going to get more benefit when we engage with those vis-a-vis other human beings, because that connection with those other human beings is going to raise our oxytocin levels, right? Which will make us much more resilient over time and give us a shot of dopamine. And dopamine itself will help motivate us to continue working on it. It's a great question. I love that one. I'm going to look at a banner because somebody just asked me about something, so I'm going to do that. Okay, but let me look at the comments. How does the irrational inference and belief lead to delusion? Um, Delusion, it depends. Delusion in the context of schizophrenia and other psychotic disorders like psychosis, brief psychotic disorder, or schizoaffective disorder, or something like that. Those are um, uh, biochemical conditions or biological conditions, right? That are not necessarily for the for the uh, for the individual without those conditions. Um, so we don't call inferences irrational; they're true or false. Okay, and so inference we look at the truthfulness or fiction of or the lack of truthfulness of an inference. We can also look at helpfulness of an inference because a false inference is rarely helpful. And in someone with psychotic disorders or an individual who's delusional will have, by definition, have some false inferences that we expect that. But false inferences do if we have false inferences, it does not make us psychotic at all. It's what is leading to those, and so we need to find those out. We do. That's why we do an intake and we consider it from multiple perspectives. And we will get to that when I look at how do we apply CBT and REBT to schizophrenia and PTSD, or even during manic phase and depressed phase of bipolar, if within those phases there's also symptoms of psychosis, okay? Delusions or hallucinations, which can happen in both both the depressive phase or the manic phase of bipolar. They don't have to, but sometimes they do. Okay, so we'll go into some of that. Yeah. So I am scrolling. Someone wanted to know about the YouTube channel, and I've got all kinds of free videos about REBT, but also other models in REBT in relationship to those other models on my YouTube channel called Psychotherapy Education and Training. You're free to look at that at any time that you want. Someone said for the girl. I'm not quite sure what they're talking about, but so I don't see any other comments here. If there are no comments, I hope to see you at episode 4, where we'll be going into many more other interventions and look at some other emotions. Okay, you guys have a great weekend and look forward to seeing you all next week. Bye-bye.